name's Rachel, and this video is just going to be about postgraduate life at Birmingham City Council. So I joined the Public Health Graduate Scheme in February 2020, and then in September 2020 I started my current role as a Senior Public Health Officer within the Adults Public Health team. My new role is quite a step up in that I have a lot more responsibility, and I now line manage a colleague. So I lead on smoking cessation and manage the Stop Smoking service. So my workload is more specific now than when I was on the graduate scheme. However, it's more varied in that I have more input and more awareness of what's going on within things such as like finances and budgeting, and also can make changes to the service. I'm also part of various groups such as hospital inpatient, lung health, and the tobacco control network. So my journey in public health, so I have a master's in global health and development, and my areas of interest are disability and development and climate change and mental health. So initially I was a bit apprehensive about smoking cessation. However, working in the adults team and being in contact with my counterparts in other local authorities and regularly meeting with NHS colleagues, I find smoking cessation really interesting now, and it's kind of reignited my passion for public health and seeing the impact the service has on the community. In January this year I started an apprenticeship which will end up being a Bachelor of Science from Coventry University. So the course is called Public Health Practitioner, and I spend 1 day a week focusing on university work. For me, I found that Birmingham City Council as an employer have been really supportive, not just in the application process, but before that in terms of like regularly posting opportunities and other kind of level 6, level 7 apprenticeships, and just like, I guess, letting everyone know, just promoting that opportunity. And the apprenticeship itself, it's really great because I get to meet other people from completely different areas of England and who have a public health background. And it's just really interesting, I guess, just comparing kind of like work streams. And I just think it's important that the apprenticeship is there, especially if you don't have a background in public health but want to work in public health, like the opportunities are there. The graduate scheme prepared me for starting my current role in that while on the graduate scheme I learnt a lot of the admin process and learnt more about colleagues and their specialist skills, such as like now I know who to go to if I need help with like an Excel file, or who can help with finance queries such as invoices or raising a purchase order. And I think one of the best things that I learned being on the graduate scheme and still take forward now is the line managing skills. It's like meeting and seeing your line manager and seeing the other managers, like you just learn so much, and it really makes you think, what kind of line manager do I want to be? So that's something I'm still developing, but I think that was one of the best things that I learned.